We'll give everybody just a few more seconds to join and we will go ahead and get started. Okay, it looks like we have a decent amount of people join this morning. We will go ahead and get started. So good morning. Thank you for taking some time to join us this morning with your busy schedules. I am Abby Burkus, and I'm the Director of Employer Health Services for Coordinated Health, now part of Lehigh Valley Health Network. And as COVID continues to progress, we're still getting a ton of questions now that a lot of employers have returned to work and are beginning to experience some new challenges. So we wanted to get everybody together and we are, Dr. Timothy Friel was gracious enough to spend 30 minutes with us this morning to be able to give everyone an update as to where we are at in the community with COVID, as well as answer some of your questions at the end. So just a few housekeeping. Everyone is muted, so please go ahead and check your microphone and make sure that you are muted. We will have Q&A at the end. If we do not get a chance to get to your questions in the time allotted, we will go ahead and send emails, updates out to everyone that did attend with those answers. If you have a question, you are able to put it in the chat box. We will be monitoring it. And we also did have a few pre-registration questions that we will be answering. So I will go ahead and turn it over to Dr. Friel.
Good morning, and thanks for having me today. A lot of information to cover, and again, we only have 30 minutes, so I do want to dive in right away. I'd like to spend maybe about 15 to 20 minutes giving you a broad overview of where we stand with regard to the pandemic and some of the major factors that are impacting businesses, industries, and academic institutions throughout our region. And then we'll turn things over for some questions. So we'll go next slide, please. So this just gives you a broad perspective. The Hopkins COVID-19 website is an excellent resource for up to the minute data, but to date we've seen over 21 million cases on a global basis of COVID-19. The deaths toll throughout the entire globe at this point, now over 776,000. If you bring it closer to the United States, we recognize that our country represents 25% of the reported cases of COVID-19 and 22% of the reported global deaths. Next slide. Bringing it closer to home to the United States, this gives you a look at two of our different curves. First, on the left in the blue box, the new reported cases by day in the United States. And you can see that we had an initial surge, followed by a long, prolonged declining plateau, followed by, unfortunately, in the early days of summer, increasing to our second surge or a resurgence of COVID-19 as the disease moved to other areas that were previously relatively unscathed in the early parts of the epidemic. Florida, Texas, the South, California as well. But thankfully now you can see we appear to be over that second hump and on to an overall decline in the number of new cases. Deaths, which have always lagged behind reported new cases, again, follow a very similar trajectory, although on a very different scale, as you can see in the green box. Initial peak, a much more steep decline, followed by a less brisk uptake as new cases in the South, largely driven by a younger population. And thankfully now we do have new interventions that we know also do reduce deaths from COVID-19. So next slide. Bringing it even closer to home. So Pennsylvania, what are things looking like? So Pennsylvania peaked with the highest number of cases of 1,733 on April 9th. And again, we hit our peak. And like the rest of the things we've seen throughout the world and throughout the country, we've seen a decline, a nice steady decline, followed by an uptick in the early days of summer as the pandemic started to rear its head, mostly on the western side of the state. So you can see we've increased, a second peak was reached, less intense, and as you can see over the last week, there's been an ongoing downward trend in the overall number of cases throughout the state of Pennsylvania. Next slide. Just looking at Pennsylvania data in a slightly different way, and this comes right from the Pennsylvania COVID-19 dashboard. The information I shared with you is highlighted in the red areas on the top, cases by day. But if you look below, deaths by day in white, and you can see again Pennsylvania initial peak at the end of April, when a number of deaths within the state hit about 190 at its peak, but an ongoing brisk and steady decline. And thankfully, we've seen some tremendous improvements, even with the second wave of new cases in the West. That death rate overall within the state has been much lower, and we have recorded, I believe, at least 2 days with no deaths within the state. Next slide. But again, COVID-19 has been a disease that's been marked by regional variation. And just to illustrate that point a little bit, I just want to demonstrate a few different areas throughout our region. So what you can see from the standpoint, this breaks it down. And again, I know it's hard to see, but top left is surrounded in blue in box is Lehigh County. Next to that in green is Luzerne County, where Hazleton is located. Northampton County in orange, and in purple is Monroe County, just to give you an example of 4 counties in and around the different areas. Scales are different, but as you can see, relative nice increases in peaks in Lehigh and Northampton counties and Monroe County, as well as Luzerne County. But Luzerne County has been experiencing a little bit of an uptick in cases over the last 2 to 3 weeks. So this is a disease where there is going to be consistent regional variation, and what happens perhaps in one community is not necessarily going to be directly reflected in other communities. And we've seen this throughout the world and throughout the country since the start of the pandemic. Next slide. Just to give you a perspective of what's been going on, so I can share our personal experience from Lehigh Valley Health Network. Since the start of the pandemic, we have tested almost 82,000 unique individuals for COVID-19. Our positivity rate, when you look at all of our testing since the beginning of March until I believe this was on Monday of this week, we have now a 10% positivity rate. That positivity rate peaked at about 33% in late March and early April, and now is hovering at a much lower number of around 3 to 5% over the last 3 to 4 weeks. And it's been relatively consistent with some regional variation, as we talked about, for example, Luzerne County in the Hazleton area, recent upticks with seropositivity rates as high as 20% on some days in the last 3 weeks. This just gives you a perspective at the bottom. Results over time. Our peak day of reporting number of new cases, 442 new positive cases in a single day in early April. As you can see over the last few days at the far right of the graph, 23 new cases reported or detected 42 days before that. So that just gives you a perspective. One of the commonly asked questions is about turnaround times for tests. And this has been a moving target, unfortunately, not only regionally, but throughout the country. And that's largely related to supply chain and other issues. Over the last 5 days, the turnaround rate for our lab that we use, Health Network Lab Medicine, is now at 1 to 2 days. About 2 weeks ago, that was up to 5 to 7 days, largely directed by some very acute or hyper acute changes in supply chain. We were unfortunate recipients of a redirect of some of our equipment and materials necessary for testing, as they were diverted to regions more hard hit at the current time in the south and out west. But we've been able to recoup from that and catch up, and we're now back to around a 24 to 48 hour turnaround time from the time the specimen arrives in the lab. Next slide. This just gives you a perspective of LVHN's inpatient experience. So as you can see, this is our curve for Lehigh Valley Health Network and the 5 major hospital campuses that we have. You can see our activity peaked in late April with when we had a total of 235 hospitalized patients at a single time with COVID-19. That's the blue graph on top. As you can see, we've come a long way, and we've been hovering in the kind of high 30s, low 40 range for the last 2 to 3 weeks of hospitalized patients throughout our entire network. And the green bar at the bottom gives you or reflects the number of ventilated patients. We peaked again in April with 63 patients on a ventilator on a single day, which is at a tremendously high number for us. We've been hovering in the kind of 5 to 10 range for the last 3 to 4 weeks, and we're much more content if we stay in that area. Next slide. So, what has been the impact of COVID-19? We've certainly felt it locally. We've certainly seen it throughout the country. And I think we're continuing to learn the true impact of COVID-19 on our country and globally as time goes on. As I mentioned, within the United States, our current reported numbers, unfortunately, our death toll is at about 170,000. But we recognize when you really look at data and compare mortality year over year, we recognize that the true toll, at least as far as deaths, since the start of the COVID-19 pandemic now is over 200,000, most estimating between 215 and 220,000. And we recognize there have been excess deaths not only related to COVID-19, but other areas since the start of the pandemic. As you can see, Pennsylvania's excess death peaked in late April, but other states, especially those in the South and out West, are starting to peak at a later time, reflecting regional and geographic variation that we will continue to experience over the coming weeks and months. Next slide. So what is the true toll? So this increase in mortality can't and isn't simply the result of COVID-19 infection. There have been many secondary consequences that have been experienced as people have delayed care for medical emergencies, such as myocardial infarctions or stroke. There have been delays in diagnosis for cancer and other serious health issues, especially during the early 4 to 6 weeks when we were totally locked down and people were fearful about venturing out of their houses and seeking medical care. And we also recognize that the toll is manifesting in other ways with increase in drug abuse, overdose, including deaths, depression, anxiety, suicide, domestic abuse, child abuse, etc. So that list can go on and on and on. So we recognize COVID-19 has manifestations above and beyond simply the disease. Next slide. And there have been huge impacts, and certainly from the business community, you recognize the economic impacts, the impact on day-to-day business, the impact on our educational systems, and even our childcare system. Next slide. So, as we think about what are we going to do as far as return, recovery, and doing our best to define the new sense of normal. I talk about the big 6 things, and these are just modifications of some of the things that we've taken to heart within the healthcare industry. But for workers within industry, etc., wearing a mask consistently and correctly, limiting crowding as much as possible, so rethinking the workspace as much as possible, keeping people 6 feet apart whenever it is feasible and possible. Encouraging regular hand washing, either with soap and water for 20 seconds or the use of an approved ethanol-based hand sanitizer. Cleaning and disinfecting surfaces, especially those high-touch areas that we encounter throughout the day. Optimizing ventilation in our places of work. And probably one of the most important things is creating that culture of safety and mutual support within our workplaces. As leaders, what can you do? Well, it's not only embracing the big 6, but it's reinforcing these strategies with your colleagues whenever you see them and setting examples for others, both at work and at home. Next slide. But again, it's really important from a business side to define the new normal. It's rethinking the workplace. What can and should we be doing differently? How do we position things to minimize crowding? How can you control the flow of individuals seeking your services, whether you're a university, a consumer-driven business space, or an administrative office place where you have lots of people working. Also looking at how can you refine or change your schedule to minimize overlap of people and prevent unnecessary crowding when possible. It's really about reimagining the norms, and we've certainly had to do it in healthcare, and I think everyone, regardless of what industry you work in, really needs to define that new normal. Next slide. Other strategies, it's really coming up with a plan that will help you monitor and respond to illness if and when it occurs. And you're just, the reality of the virus is that most people will encounter some illness in whether it's within families, within workers, or people who seek your services. You need to establish practices for symptom monitoring, encouraging those ill to stay home. And that's, one of the most important aspects of changing our culture. We have all experienced times when we showed up at work sick and not feeling our best. And we've got to rethink that in the COVID era. In addition, when people are ill, we need to encourage them to get tested. We need to understand whether diseases or symptoms are a manifestation of COVID-19, because if they are, there's repercussions for everyone who comes in close contact with that individual. Encouraging those who've been exposed to stay at home and monitor and respect the recommendations for quarantine. And really developing site plans for responding to confirmed cases, such as restricting areas and encouraging good, proper ventilation. What's encouraged by the CDC is at least 24 hours when and if feasibly possible, followed by aggressive sanitation of the area. Reviewing your sick policies and your leave policies, reducing business-related travel as much as possible. If it doesn't have to be done, probably shouldn't be done, and establishing connections with expertise to assist with challenges. This is a really appropriate time to have to be able to phone friends with expertise. And it's one of the strategies that we've been employing, both in the workplace, utilizing the broad bench of talent that we have here to help us navigate this epidemic. But assistance in contact tracing and guidance for management of outbreaks or exposure are going to be really, really important. And that's one of the ways that Lehigh Valley Health Network can and will remain a partner to our businesses and colleagues throughout the Lehigh Valley and the surrounding areas that we serve. Next slide. The other thing I think is important for all businesses is to really instill confidence. And that confidence, when you're talking about confidence, we're really talking about two different audiences. First is your client, your consumers, students, families, etc., the people who seek your services. But just as important is the people who work for you, your colleagues, your workers, your employees. We need to consistently and reliably demonstrate our ongoing commitment to safety, to innovation, and to customer services. And I think it's important to make those changes and interventions that are put in place visible, so that people can not only understand what you're doing to keep them as safe as possible, but they feel it when they utilize your services. People ask a lot about temperature screening, and I know it's one of the issues. And this is one where it's been a bit controversial. The bottom line is temperature screening sometimes instills in the consumer eyes a sense of confidence, but we have to recognize, I don't want people to put all their eggs in one basket. It looks good, but it's not always a perfect strategy. You can miss things when you're just screening for temperature, and depending upon the type of thermometers you use, you can get very, very variable results. We've had problems reported by different individuals throughout the summer months where thermometers aren't great, people coming in from the heat, high temperatures repeated 1 minute later, they're low again, etc. So it can lead to some confusion. So we've really encouraged, especially among employees, that they do self-checks at home prior to, and really monitor themselves. We still do check temperatures at our hospital, but it is a challenging thing to enforce. And I think there are other regular strategies that will just as regularly instill confidence in the people who use your services. And the other thing I remind folks about is not overlooking the importance of the mental health of your team, and providing a supportive environment where people can voice their questions, voice their concerns, and be supported as they navigate some of the uncertainty that exists. Next slide. You also need to look at your out of work policies, et cetera. So, frequent questions are what happens. So when people are diagnosed with COVID-19, they have a test that confirms their infection. It is recommended by the CDC and the World Health Organization that folks remain isolated. That means staying away from others when you're sick for 10 days following the onset of symptoms, or for someone who's entirely asymptomatic, 10 days from the date of their test. with at least 1 day of improvement in symptoms, including the complete resolution of fever without the use of fever-reducing medication. There's a rare exception to that. Those who are incredibly severely sick, they are on ventilators or receive intensive care unit care, or those who have severe underlying immunosuppression. Those individuals are recommended to isolate for 20 days. So one of the things that we have seen, though, is prolonged COVID-19 symptoms in patients who have been infected. So they might have cough or fatigue or rapid heart rate when they change positions, et cetera. So we're seeing that reported in a significant minority of patients, but it is an important number of individuals. That doesn't mean that they're still infectious. The data suggests right now that people are only infectious for about 10 days after their diagnosis or symptoms develop. One of the challenges, though, of COVID-19 is that they also appear to be infectious fairly reliably in the 24 to 48 hours prior to developing symptoms, which has made this such a challenging condition to control and contain. Next slide. Out of work also involves importance of keeping people what we call quarantined after exposure. So quarantine is when you're not ill, but you've been exposed. And quarantine is recommended for 14 days because the typical incubation period for COVID-19 is anywhere from 2 to 14 days. The vast majority of patients will develop disease by about 11 to 12 days. The most common day of developing symptoms is 5 days after exposure, but 14 days is the official typical incubation period. And that follows, so exposure really needs to be defined as what a significant exposure, and that is spending time within a close proximity. We use 6 feet as our marker for a prolonged period of time. And different places will make different recommendations about that time. 10 to 15 minutes. We use 15 minutes at the hospital for doing assessments of our high-risk situations without the use of appropriate PPE or personal protective equipment. Next slide. So what is personal protective equipment? Well, the most important thing that folks can do outside of the healthcare industry or other high-risk situations is masking, and masking is essential. We've learned a lot about masks, and avoiding masks with exhalation valves is really important, because exhalation valves defeat the whole purpose of wearing the mask by allowing the free exchange of exhaled particles and droplets into the environment. It is okay for people to wear them if they are wearing another mask on top. And there's also newfound concerns about things like gaiters and bandanas that we can perhaps talk about during the question and answer period. The other considerations for those who have closer contact with individuals: protective eyewear is something that we require, or face shields, for all folks who are working in healthcare with direct patient care. And any direct contact, we do recommend and require the use of gloves for direct contact. Using gloves for other areas is not something that we definitely, unless you're having physical contact with individuals, we don't encourage, unless it's a situation where you are handling objects or items that are going to be immediately handed to a person. But then frequent glove changing is also important. And consider the placement of barriers when and if practical. Next slide. Other strategies, as I mentioned, that phone a friend, aligning with expertise and community partners. And we're certainly at LVHN very happy to be supportive to you as you navigate some of the uncertainties and questions that you might experience over the coming days. And also utilizing and encouraging the use of tools like telemedicine for folks who need evaluation. We still, when people are sick, we want them to isolate as much as possible. And we have links to multiple different virtual care options like televisits or video visits, as well as e-visits, that are available 24/7 for anyone who has questions, concerns, or needs an assessment. Next slide. And then I think, again, we talk about the other thing to do to instill confidence: communicate. You can't communicate and educate enough with your staff and with the people who utilize your services. Next slide. And again, so I'm going to wrap up with what I call the 3 pandemics. And we really faced not only a pandemic of COVID-19, but certainly fear and misinformation. And that was important. And that's why communication and education has been so important. and maintaining those streams of communication has been really, really important. Next slide, though, as we've moved forward, though, we were confronting probably the fourth pandemic. It's fatigue and complacency within our society. We're all tired of this, and we really do want things to go away. Unfortunately, the virus doesn't necessarily work that way. We can't just wish this away. Next slide. So, one of the most common questions, and I'll end with this slide, is when is this going to end? And really what it's going to take is the development of an effective prophylaxis or a preventative. And unfortunately, we don't have any great candidates at this time. It's the development of effective therapies, and we've made progress. Dexamethasone and remdesivir are helpful. They are not perfect by any means. The development of an effective vaccine, as you can see, this is from the New York Times Coronavirus Vaccine Tracker. We have over 135 vaccines being evaluated. 8 have moved into phase 3 clinical trials. 2 are listed as approved. Now, those are with clear asterisks. These are the vaccinations that have been approved in China and Russia, and there's a lot of skepticism about the level of assessment that has been put into those vaccines. So, they're listed as officially approved, but not necessarily, in my mind, a viable product that's going to be widely impactful at this time. Or the ultimate development of herd immunity, which typically for other diseases requires at least 60 to 70% and sustained protective immunity in our communities. And unfortunately, even in hard-hit areas, the estimate of that where we are right now, as far as those with protective antibodies, only hitting about 20% in hard-hit New York City. So more to come as we move forward with this. So what I'd like to do, that was a broad overview, and I went a little bit longer than I'd like to, but I'd like to open up things for questions from folks. For folks, we can skip over these.
So thank you, Dr. Friel. This is a lot of great information. If you have a question, feel free to go ahead and put it in the chat box. I don't see any in there as of yet. So while you're doing that, we will go ahead to the pre-registration questions. Some I know you did answer in your presentation regarding the length of time for test results, currently 1 to 2 days. The temperature screenings you briefly touched on, the question is the recommendation for temperature screening being practiced by local employers? Is it the recommendation for temperature screening?
So I think that becomes a personal choice for different organizations. It is not mandated, and when temperature screening, what has been recommended is at least there's some plan for temperature screening, whether it's telling your employees and colleagues to have their temperature checked at home before they arrive, coming up with the honor system, that is an acceptable policy, or checking there. I just want people to recognize some of the challenges of maintaining that as they move forward. It comes down to what you're capable of performing, but we do have to remember, just by checking someone's temperature at the time of arrival isn't the entire story. And if people's clinical situation or changes throughout the course of the day, if new symptoms are developed, et cetera, they do need to be encouraged to report that and leave the workplace if they are not feeling well during the course of the day. So like I said, I don't want to overstate or have people put too much faith in temperature screening because there are a lot of ways around it. And as we talked about, one of the biggest challenges we have with COVID-19 and the virus that causes it is that individuals can and are infectious prior to developing symptoms, those symptoms including fever. So I don't want people to be lulled into a false sense of security that a temperature check might provide.
Okay, thank you. The next is when we are looking at someone's close contact list and use the 6 feet, 15-minute guidelines, should we be taking into consideration if someone is wearing a mask? At my company, we have not taken that into consideration and just treated someone as a close contact if they were within 6 feet for 15 minutes or more.
Yeah, so this is where I think the importance of contact tracing and utilizing folks who've been trained in this. It does depend upon the type of masking, and we certainly do that. So I take care of COVID-19 patients, as do all of my colleagues. And if we are seeing a patient, we've taken care of many of these patients. If we are wearing the appropriate personal protective equipment, so if I'm touching someone and wearing gloves, and I'm using my eye protection and wearing a mask, that is not considered a high-risk contact because I am protected. So masking does have to be taken into place. The problem, if you're in for prolonged periods, then it comes down to the type of personal protective equipment. Were they wearing it for all times? One of the things, and I didn't have a chance to explore this, but one of the greatest vulnerabilities we've experienced in the healthcare system, and I know talking to my colleagues across the country in infectious disease and other areas, the biggest time of vulnerability is break time and lunchtime. So we tend to be really, really, really good in our healthcare system when we're taking care of patients, but we let our guards down when we're eating. We crave company of others, and typically our workspaces haven't been designed for social distancing in the break room or in places where people eat lunch. And typically people are spending, you have to take a mask off when you eat and drink, and you're typically spending 10, 15, 20 minutes in those situations, sometimes longer, in closer proximity. And that's where we've been burned most frequently, and I ask people to really think about that. I encourage all of my colleagues, when you can do it, go outside and eat. Outside is always going to be better than indoors, just because of the ventilation that outdoors provides, and it's a much safer environment.
Okay, the next one, how important is it for employers to encourage influenza vaccination?
So I'm an infectious disease doc, so you are going to get the answer that I think most people expect. I cannot underestimate I cannot overstate the value of vaccinations in the public health of our country. So it's one of the things I think we need to be proudest about, and the impact that vaccination for some really, really serious illnesses have had. Why is influenza vaccination so important this year? Well, we are facing the possibility of, once it gets colder and once more and more people are moving indoors, et cetera, we do very much worry about that proximity and the indoor lack of, ventilated areas really serving as a situation that increases the risk for transmission of COVID-19. If we are also dealing with a simultaneous pandemic of things like influenza and RSV and some of the other viruses that tend to rear their ugly heads in the fall and winter and early spring, we're really going to have a challenge. Not only a challenge of, with a huge number of people who are going to need and seek services for medical care and support, but also differentiating the difference between influenza and COVID-19. There's huge, huge overlap here. And that's why doing everything we can to reduce the likelihood that we have a bad influenza season is going to be important. And the best way we have for that is the utilization of influenza vaccination.
Okay, it is 9:01, so we will do one more, and the rest of the questions, please keep sending them in. We will send out all the answers to all of the attendees after, so we can still continue to answer all of your questions. Can an employee contact LVHN to discuss concerns about their potential exposure to a positive workplace case?
So it's a fantastic question. So we have a 24/7 nurse line available, that is manned by our nurses, and we field calls 24/7, 7 days, every day during the week, of people who have concerns and questions about coronavirus. Those exposure questions are incredibly, incredibly common, and we can use our clinical expertise to help navigate. So I really do. I encourage people, this is the time to really phone a friend when you have questions like that. And we've developed the resources that are available for folks to really reach out and help navigate any of the questions that they might have. So I encourage people to do that. And if people are developing symptoms, or they're worried, or they're concerned, and they want a convenient way to access those support, there are so many different methods that are available. There are the nursing hotline, and we have protocols that are put in place. We have our online video visit platform, or even just calling your primary care doc for direction and guidance as you make some of these decisions. It is okay to seek advice, and it's not only just okay, it's highly encouraged to do so.
Okay, thank you so much, Dr. Friel. If you can go to the next slide, Tyler. We want to hear from you. We want to continue to be able to be a support to you, and as you continue to go through new challenges, and as you continue to modify your workplace, we want to hear from you. If you come up with questions after this, if you're sitting thinking about the presentation, go ahead and email Carissa Vetrano or Scott Apnell. They are your main points of contact that we can get you in touch with someone. We can get your questions answered by Dr. Friel and his team. So we want to continue to be here to support you through this. We know it is not easy, and that's why we want to continue doing this. We're getting a lot of the same questions, so what better way than to bring the group together? So thank you all so much for your time this morning. We really appreciate you. Thank you so much, Dr. Friel, for taking the time. It's been great information. So thank you. Have a wonderful day.
Happy to help, and everyone stay healthy. Take care.